Hello, my name is Carissa Jackal, and I'm a developmental behavioral pediatrician at the Children's Hospital of Philadelphia. My current study is entitled Factors Associated with Developmental Behavioral Pediatricians Prescribing Psychotropic Medication to Children with Autism Spectrum Disorder, a study of 3 DBP-NET sites. We don't have any medications to treat the core symptoms of autism spectrum disorder, but we often use psychotropic medications to help treat some of the associated symptoms, such as irritability, hyperactivity, impulsivity. We know from previous studies that 27 to 64% of children with ASD are treated with psychotropic medications. This is extremely important to developmental behavioral pediatricians, who I will be referring to as DBPs, because autism spectrum disorder is one of the most common conditions that we treat. We also know that there are some child-specific factors that influence prescribing psychotropic medications, such as older age and behavioral comorbid diagnoses. There's been some controversy in the literature regarding private versus public insurance and whether or not having private versus public insurance makes you more or less likely to be treated with psychotropic medications. So the aim of our study was to describe the variations in prescribing practices and also to look at the factors associated with developmental behavioral pediatricians prescribing psychotropic medication to children with ASD. Our data came from the electronic health record of 3 DBP-NET sites. DBP-NET is, for those of you who don't know, is the Developmental Behavioral Pediatrics Research Network, and it is a consortium of 12 academic medical institutions that have clinical developmental pediatrics programs with a goal to conduct collaborative interdisciplinary research. So we looked at all new and follow-up visits for children with ASD over the 2-year period from January 2010 through December of 2011. We ended up looking at the 3 different sites with our electronic health record data, and we ended up finding some significant differences between the sites. For example, the sites were located in different parts of the United States, and they also differed in size in terms of the number of patients they saw and also the number of physicians and clinicians that they had. The largest site having 14 attending physicians and 6 advanced practice nurses, and the smallest site having 5 attending physicians and only 1 advanced practice nurse. So we ended up looking at a total of 5,095 patients, which ended up being around 11,000 new and follow-up encounters. We saw that, as expected, children who were older and children with behavioral comorbid diagnoses were more likely to be prescribed psychotropic medication. One of the most interesting and clinically significant findings within our study centered around insurance, and we found that this varied by age. So we saw that 3 to 5-year-old children with Medicaid as their primary insurance were statistically significantly more likely to be prescribed psychotropic medications compared to children with private insurance as their primary insurance. We did not find any significant differences based on older age categories. When looking more specifically at medication classes, we also found that the odds of 3 to 5-year-old children with Medicaid as their primary insurance being prescribed atypical antipsychotics or alpha-2 agonists was 2.5 times that of those with private insurance. This ends up to be a very significant difference and important because psychotropic medications have significant side effects. So although they are helpful for symptom control, they can lead to significant side effects that clinicians need to be aware of. Unfortunately, our study was not designed to determine the reasons why developmental pediatricians more often prescribed psychotropic medication to younger children with ASD. And I recommend going and reading our article to find out some of our different hypotheses. Future directions should really focus on trying to figure out the exact reasons for these differences and making sure that clinicians are aware that these differences possibly exist. Thank you for listening, and please enjoy the article.